Hello, I'm called Kenira Maroyi. My presentation is about the prevalence of urinary incontinence in pregnant and postpartum women in the Democratic Republic of Congo. Nothing to disclose. This study aims to determine the prevalence of urinary incontinence, identify associating factors, and its characteristics among pregnant and postpartum women. Upon prenatal and postnatal reproductive health clinic consultations, women were asked to participate in the study. Those in the third trimester of pregnancy or within 18 months postpartum were deemed eligible. Interviews collected information regarding demographic, obstetric history, and urinary incontinence symptom and quality of life impact via the ICQ-UI questionnaire. We compared women with and without urinary incontinence, and the factors associated were identified using logistic regression models. The mean age of participants was 27. The majority of women worked within the household and had secondary education. None of these demographics were statistically significant, indicating that the women in this study are comparable. Among maternal and obstetric factors, women who had a history of macrosomia were more likely to have urinary incontinence. Women who were in their third trimester of pregnancy were also found to be more likely to have urinary incontinence. Pregnant women in this sample had a mean ICQ-UI score of 10, and postpartum women had a mean score of 11. Postpartum women were statistically significantly more likely to have an IICQ severity score. When asked when the urinary incontinence occurs, pregnant women were more likely to endorse that they had linkage when they coughed or sneezed. Pregnant women were more likely to have stress urinary incontinence and mixed urinary incontinence compared to women who were in postpartum. Huge urinary incontinence did not differ significantly between the groups. Among the 818 women included in this analysis, women who were currently pregnant and had a history of macrosomia were at an increased risk of urinary incontinence. The findings show among pregnant women, women's gestational age was predictive for urinary incontinence. Those with a history of macrosomia were more likely to have urinary incontinence. And among postpartum women, those who had a history of macrosomia and prior episiotomy were more likely to have a urinary incontinence. To conclude, in this analysis, urinary incontinence was found to be prevalent in pregnant and postpartum women in the DRC. Urinary incontinence was found to be more common in women earlier on in their third trimester and those with a history of macrosomia. Given that almost one-third of pregnant or postpartum women in the DRC experienced urinary incontinence, health interventions are warranted to address this condition. Pelvic floor muscle training have been shown to be effective in preventing urinary incontinence in pregnant and postpartum women without incontinence prior symptoms. Incorporating information regarding pelvic floor muscle training into postpartum care plan can help to reduce the burden of urinary incontinence on subsequent pregnancies. Thank you for your listening.